see up here. All right. Hey everyone, thanks for joining me. Just checking in with you guys. I'm on my way home from work. Just wanted to put up one of these metrics here. It's taking a look at the places that have unvaccinated populations mostly in terms of the states in the U.S. here versus the ones that have hospitalizations. Now, um, this chart doesn't really break down the differences between those that are vaccinated or unvaccinated upon admission, but it does basically show that there are cases or states that have large amounts of hospitalizations, particularly when there are unvaccinated people. So the main thing here to look at are those that areas that are largely unvaccinated are the ones that are typically having more trouble. Now, other areas that have been vaccinated, well, are still seeing a rise in cases. No one area is impervious to COVID at the time, but you can clearly tell that the places that have not taken advantage of vaccinations are getting hit hard right now. And there is one other background I was going to put up, but I don't want to adjust that during the live. And it's the unfortunate case of the 13-year-old girl who recently passed away. She was presumed healthy, no comorbidities, no issues, down in Mississippi. I believe it was Mississippi. And she passed away from COVID. And I'm not blaming it on the school not having a mask mandate. That likely played a portion in it. And even though I don't think she wasn't vaccinated, I think that could have been an issue too. I don't know what the availability for vaccines were for her in their area there, but I know children under 12 currently are not approved for having vaccinations. But the ages of 13 to 18, I think, are currently eligible for vaccination. But this really isn't an issue of whether she had been vaccinated or not. It was sort of a mentality of her region that they weren't really going to be vaccinating people heavily, and they weren't going to wear masks at school. And I've had some interesting talks lately with other people, and I think that one of the most intriguing articles that I read recently, and it's going to sound kind of funny, it was actually an article written by Arnold Schwarzenegger in The Atlantic magazine. And it was basically dived into how individuals during one of the toughest times in our history, the Great Depression and World War II, how they rationed food, gasoline, recycled metal, and all of these things as an effort to help us to go off and fight during the war. And the other point of the article was our population in the country at that time was so willing to help out their fellow population, the rest of the U.S., but we're getting into this whole argument about masks today, and this is not just a United States problem, this is a worldwide problem, and we're drawing the line in the sand over wearing masks. And I'm not here to say that masks are the cure-all and they will definitely prevent all infections, but when you try and vaccinate, when you wear masks, you try and do some social distancing the best you can, and you try and limit the probability of spread. This is nothing that will completely reduce uh, um, I'm sorry, what does it say? The glorified nurse lecturing us about vaccinated this rich. I don't know where that came from. I'm not a nurse, I'm a doctor. I'm not a nurse anesthetist, I'm an anesthesiologist. I did medical school here in the U.S. I went to my residency at Johns Hopkins University. So I've done pretty well with education. I've done some highly competitive specialties and highly competitive hospital to do my time at. So you're a doctor and I'm Santa Claus. All right, well, that's cool, man. I'm glad that you're a Santa Claus. But anyways, so basically the whole idea about vaccinations is trying to reduce the chance of people contracting the disease and spreading it. Like I've said before, getting vaccinated is always a individual risk-benefit analysis for you. And I've said before, I think that for most individuals, it is safe and the benefit will outweigh your risk, even if you're healthy. Um, so it's really an individual decision, and people, I'm not going to harp on you about not getting vaccinated, but we are starting to see significant rises in cases, and the data is not lying. The people that are in the hospital for the overwhelming majority of cases this time around are non or unvaccinated people. And the scary part now is the fact that children are starting to become more and more affected. Was your education given to you before COVID? Asking for a friend. Yeah, I don't know why you wouldn't think that. I've been practicing now for 3 years, and during this pandemic, I've been in private practice the whole time. So, 0.00 chance of dying. So people always talk about this low rate of dying with COVID, and the issue with that is when you put that into an entire population where there's no intrinsic immunity. I know people have been infected now and there have been vaccinations, but this was the idea before we had vaccinations. You have 350 million eligible hosts. So even if you take a very small percentage of those individuals and they die, that is a huge amount of the population in terms of just sheer number. The doctor, show some respect. Yeah, I mean, thank you for saying that on my behalf, but everybody's going to have their opinions and say what they want. I'm merely here to try and pass on actual data, educated information. People can take it as they want. I'm not here to push anybody to do anything they don't want. I just want to provide people with information. So let's see what else we got here. There is also long COVID where people have serious. Yeah, and that's the other thing that we have people who have long-term neurological and cardiac issues, and then also the respiratory issues where hopefully a lot of these things will improve over time, and some of the cardiomyopathies that develop where people have weakening of the heart muscle, some of those things have improved slowly over time, but then sometimes individuals have not had a resolution of their deficits, whether that's been the neurological thing I discussed, pulmonary, or cardiac. So you don't know these long-term sequelae that can happen. So the main thing now is trying to prevent things from happening. And I said this before, I think that it's sort of ironic that some of the people that don't want to become vaccinated have talked about ivermectin, hydroxychloroquine, all these other medications that they believe to be effective, when actually the case is they're not effective. Ivermectin is about the only one that had any sort of data saying that it may be helpful, and it didn't reduce hospitalization or morbidity or mortality. It just helped to reduce some of your symptoms. It didn't prevent being infected. It doesn't prevent the spread of the disease. And people say, well, it's a medication that's been around for a long time, but we don't use it a lot. It has a lot of side effects. There are other better medications that are currently used to treat things that they treat now. So, for example, ivermectin is used for parasitic infections. There are much better medications out there now than ivermectin. Hydroxychloroquine, the same thing. That was touted there for a while. There are much better medications that are used instead of that now because of their side effect profile. So it's kind of ironic to me that individuals will tout these medications because they've been around for a long time, as if the fact that they've been around for a long time means that they're necessarily safer than the vaccine that we have. And the thing about the vaccine is, while they recently made the vaccine to be specific for COVID-19, the technology behind it of having an mRNA vector has been studied since the first SARS outbreak in the early 2000s. And then that technology has been researched since then. And then they've now modified the mRNA sequence to match COVID-19 spike protein so that your body will produce the antibodies to it. So while the vaccine itself is new, the technology behind it is not new. Let's see here. Okay, I got a lot of comments here to catch up on. Let's see. Oh, sorry. So the chart behind me basically is they're showing that the states that have high unvaccinated rates um, are also the ones that are having high amounts of hospitalizations. And I'm sure people have been filtering in, but I did say that this chart doesn't really dive into whether the individuals that are hospitalized were vaccinated or not vaccinated. But there are plenty of other charts that show that of these numbers, for example, like Alabama, the 446, I can't tell you for sure how many of those were unvaccinated, but there are other charts that will show you that usually in most places that about 90, 95, even 99% of people being um, admitted to hospitals for COVID are unvaccinated. And then that percentage is definitely true for those that are requiring ventilation and being placed in the ICU. Let's see here. I just had COVID 3 weeks ago, so I have antibodies now. So I'm not going to argue about that either. There is immunity from getting the disease itself, so you do have antibodies. The only thing I will say is that, for example, you don't always have a good enough immune response from the infection itself. And this isn't just COVID. So, for example, when somebody has a tetanus infection, you can actually get the effects of the tetanus toxin without it eliciting an immunological response, meaning that you're not going to be immune to tetanus if you're exposed in the future. You're going to need to go to the hospital to receive treatment. It's called a sub-immunologic response. The organism is able to go in and release its toxin and replicate to the point where it causes you symptoms, or your body doesn't mount a robust response against it. Now, COVID is slightly different. You do get a decent response from the infection. You do have antibodies, so you will have some immunity, but the response is not nearly as impactful, or does not have as much longevity as getting the vaccine. Vaccines have recently been shown 8-9 months of immunity. And now the biggest question, and I'm not here to talk about the booster in terms of promoting it or not. Everything I have recently seen was basically stating that those that are immunocompromised are likely the ones that should take the booster, meaning they probably didn't have enough of an immune response from the first 2 shots. Now, until we have more data, maybe 3 months from now, showing the 1-year follow-up um, from how well your antibody levels stay high after COVID, after the COVID vaccine, then there might be evidence that the booster is needed for healthier individuals or those that are not immunocompromised. But for the most part, I haven't seen anything suggesting that anybody outside of the immunocompromised, meaning other high-risk populations, for example, the elderly or those in the healthcare setting that might be exposed to high levels of it, taking care of COVID patients. I have not seen anything at this time that says that those individuals would absolutely benefit from the vaccine. So, I'm sorry, not the vaccine, from the booster shot for the vaccine. So so we will see in the next few months if the antibody levels for those vaccinated will start to wane some and warrant getting a COVID booster shot. 135,000 deaths from the vaccine. I don't know where you're getting that number at from the vaccine. Let me just give you an example. An ICU doctor, this is one of the best quotes, and this goes beyond politics, beyond testing, false positives. We have yet to see a hospital full of individuals dying from the. Sorry about that. My phone actually started to overheat there for a second, so it made me turn it down for a second. No, but what I was trying to say was we have definitely seen hospitals overrun with people dying from COVID itself. So I I understand people's skepticism of the vaccine. I understand people not being trustworthy of mass media, but there are countless physicians, nurses who have seen these things firsthand. So my question to you all, the ones that truly believe that vaccines are wrong, that this whole thing is a hoax, what is killing all of these people in the hospital that all of our modern medicine is not been that great at treating? And before the novel testing developed, what were we not able to detect? And I'll wait. I will see what any of you guys' opinions are on that. I'm not putting anybody on the spot. I'm just would genuinely like to know. And I don't think there's anything wrong with having skepticism and asking questions and trying to educate yourself. But my question is, what is killing hundreds of thousands of individuals in our country and millions around the world that our healthcare system was completely turned upside down by, if it's not COVID? And I've yet to talk to anybody who can answer that question and give me any sort of rational answer. I'll fight them all at this point. 03 boom boom. I mean, that's fine, man. You can be on here and say what you want about stuff. I'm not here to force you to have something done. I'm just trying to tell you that there are patients that we have seen in the ICU that want to get vaccinated, but it's too late, and they are getting ready to be put on the ventilator, and unfortunately, some of them pass away. This is just a warning to people trying to reach out. We go into healthcare trying to help individuals. That's what we sacrifice our lives for. Our 20s are usually gone. We want to go out and help people. So hearing this conspiracy theories about physicians making money off of this is perplexing, because physicians have no ties to most of, or essentially any of the companies that are involved with the testing or treatment. Now, there are some politicians that have had things that have come out that have been different stories regarding that, but I can't comment on the details of those situations. But in terms of the healthcare providers, the ones on the front lines taking care of these patients, we don't have an agenda. I have no agenda. I don't own stock in Pfizer. I don't own stock in Moderna. I don't have any stock in Johnson & Johnson. I don't get any benefit from these vaccines. I don't have any stock in any of the novel treatments or any of the testing companies. That's not why we're here. Wrong. The guy is definitely not a doc. This guy is definitely not. Okay. Well, apparently you're just going to continue to say stuff, and that's cool, man. So, he should make you a moderator. What exactly do you know? That sounds like a lie. I know that I have a master's in biochemistry from FSU, and I'm not taking it. That's fine, dude. And if you have your own thoughts on that or research, I'm just trying to tell you that as a physician who's been relatively highly trained, and I went to the best, the #1 anesthesia and critical care medicine residency in the country. #1, look it up, Johns Hopkins. You can go back, 2018, there's my picture, class of 2018 if you don't believe me. And I'm not hating on your masters. I'm sure you are very smart in biochemistry. You're entitled to not take a vaccine. Is vaccinating children 16 under necessary? So honestly, that's my biggest concern right now. I have a 6-year-old and a 3-year-old, 2 daughters. Our 6-year-old is going to 1st grade. Our 3-year-old is at preschool here in our neighborhood. My biggest concern is them getting it. The Delta variant seems to be affecting the pediatric population far more this time around than the Alpha variant. It seems to be much more contagious, and the pediatric ICUs are filling up. So this is not a scenario of kids just having to go to the hospital, maybe to the ER and then sent home and testing positive, or even the high-risk children. We're seeing healthy children having a problem now. $135,000 for the vaccine. Look at his page. There's been literally 3 deaths from the vaccine. Show your work. I'll spare myself. I mean, maybe he is an anti-vaxxer, and that's fine. I'm honestly not here to fight with the anti-vaxxers. If that's what they believe and that's what they want to do, then that's fine. Everybody's entitled to their own opinion. Come visit us in the WICU. Yeah, I'm not at Hopkins anymore. I would come visit you, though. I finished there in 2018. Maybe that's what you want to relegate me to, but that's not the case. Like I said, I'm not here to paint you as an anti-vaxxer, and if you are, that's fine. But all I'm trying to tell you is that these are the facts. But the problem is most individuals in this scenario are only going to say, well, we don't know how to trust these numbers. Again, these things are made by mass media, but the countless number of nurses who have been on social media and even on mass media giving firsthand accounts of what is going on within the hospital. And I've told numerous people this. This is the first time, I think, in the history of our country that we've had something so divisive occur despite having so much evidence for it. So it's just kind of perplexing when it comes to that. And also disheartening, trying to care for individuals, but people still don't want to help themselves. And I've had ethical questions asked to me on whether people who decide not to get the vaccine should be able to take up an ICU bed. And I've answered before, as a physician, we will always take care of somebody who shows up. But do I think it's fair? I personally don't think it's fair, because it's not even whether somebody else coming in after you has COVID or not. It could be somebody's relative or your husband, wife, child, anything like that, having a heart attack, stroke, trauma that needs an ICU level bed that could have been avoided. And then throw on top of that the financial burden to the healthcare system. It's much cheaper to get the vaccine, 2 shots, than it is to be stuck in the ICU for several weeks on a ventilator. I don't understand the fear of the vaccine at all. I'm not a scientist, so I don't argue with doctors. I trust that they know what's best for me. Because you can pass it to people not eligible for the vaccine, and that's the main thing. And then it's not so eligible for the vaccine, and we have the pediatric population who's at risk as well. Before, it wasn't as huge of a deal because the kids that were getting it were either completely asymptomatic or not having to go to the hospital. I'm truly concerned for the reopening of schools. And I mean, we've already started to see some rise in infections. So unfortunately, some children have died. And I'm not here to say that child, unfortunately, may have died anyways, whether they were vaccinated, unvaccinated, wearing masks. But the whole idea is that you have a multimodal approach to trying to help with this pandemic. And that means between vaccinations, masking, social distancing, all of those types of things, your goal is to reduce the burden on the population by using all of those things. Not one thing is the perfect thing. I would say, obviously, out of all of those, the most effective thing would be the vaccine. But just because you're vaccinated, the two most popular ones, Moderna and Pfizer, 95% effective. Not 100%, 95%. So 5% of individuals who get the vaccine, unfortunately, will not have enough immunity to protect them from COVID. But that doesn't mean that the other 95% aren't benefiting from being vaccinated. And the whole idea is that if you get enough people vaccinated, you have herd immunity, which is also why things like MMR, measles, mumps, and rubella, there's herd immunity for that. So people have the luxury in our country of foregoing vaccination sometimes for that, because so many people around them are vaccinated that those infectious diseases can't take hold in the community because so many people are vaccinated. That's the idea of the herd immunity. And the whole thing is, if we can try and work our way towards that, as well as doing the social distancing and masking the best we can in crowded environments, we're just trying to give ourselves a fighting chance and do what's best for our country as a whole. Let's see. I'm just going to try and catch up with some comments. I'm getting a lot of messages here. So if you're vaxxed and I'm not, then why do you care? So honestly, it was kind of what I was touching on, and like personally, I don't want something to happen to you. As a physician, I just don't. You can sit here and say agenda, that's fine. But as a human being and a physician, I don't want something bad to happen to you. So the whole idea also is that if you're one of the rare few, say you are a healthy individual, there are some people that are healthy or may have one comorbidity. Even being overweight is enough to make some people have to go to the hospital from COVID. You are then utilizing medical resources that could have easily been avoided by just getting a shot. That's the mentality behind it. And I actually had this conversation at work with somebody today. We live in a society where we've always had an abundance of medical resources. So we've never felt the pinch of not having enough resources to go around. So until somebody shows up to a hospital with their dying child or husband or relative and they get turned away, then people will start to truly understand what we're talking about with medical resources being stretched so thin. But if I'm vaxxed and can still pass it on, then why get vaxxed? So the whole thing is you lower your chances. This is not, and this is the problem. Everybody does this. It's not a black and white scenario where you have 100% or 0%. It's a probability game. You're talking about a virus that replicates in your body on the scale of billions and billions and billions, where you have chances for replications and mutations, and you have that viral load that then can get spread to somebody else. The idea is that the vaccine reduces the amount of the viral load you develop, which should then lower your chances. It's not always going to completely rid you of spreading it to somebody else or completely make you impervious to infection, but it's going to help you significantly. I'm waiting for that day to come. Right, but you're talking about anesthesia. I don't understand what you're talking about with anesthesia. I'm an anesthesiologist, but during our training, we get training in critical care medicine, so we have plenty of time in the ICU. So I'm not sure what you're hinting at with that. And I'm not referencing anesthesia. We deal with COVID a lot because we have patients who have COVID in the hospital, and we've had to deal with patients coming to the OR. At our hospital, we were cross-credentialed to help out in the ICU. So we have a lot of exposure to ICU in our training, so it's not just anesthesia. Still not get vaxxed, and that's fine. You guys can say what you want about not getting vaxxed. I'm not here to sell you on it. I'm just trying to show you the facts and just trying to get the point across of what some healthcare workers are feeling. We're trying our best to continue to help, and now we're starting to see a fourth wave coming through. My girl has a degree in biochemistry, and she's just concerned how fast it mutates. So the whole thing about the mutation is that luckily it's actually mutated quite slowly. My prediction was we would have if we had more buy-in from the vaccine, that the pandemic would have been significantly under wraps within about 18 to 24 months from the time this all started. And that only would have changed to being an annual issue if it started to mutate faster. Because when people started getting it in very late 2019 and very early 2020, you could imagine that with the flu, it mutates in about a 9 to 10 month span, because when they make the vaccine for the next year, they have to try and guess what it's going to be. So the vaccine starts to come out ahead of time for the flu shot. Now, the flu mutates basically once a year. So anywhere from 9 to 12 months, there would be a significant mutation. So far, the COVID strain hasn't mutated that significantly. Now, the Delta strain is more contagious. It is a mutation. But the vaccine still seems to be significantly protective of that. With the flu vaccine, you look back a year, your flu vaccine's essentially ineffective. There's been a significant amount of mutation that's occurred where your prior immunization has very little to, if any, significance for that new mutation. So that's the only reassuring thing. Now, if this thing does all of a sudden take a huge shift where whoever's been vaccinated is no longer protected at all, then we're looking at an annual flu-like situation where we're going to need vaccines each year for COVID. But I'm hoping that's not going to be the case. And don't cry when we don't defend you against the government that is owning you. I guess you're still talking to me. I don't know if you're talking to somebody else, Alex Banks. Really appreciate all your input. Thanks for your help with this pandemic. Absolutely, I'm glad to help. And luckily, where I'm at currently, we're starting to see our fourth wave. We haven't had nearly as bad as the other major cities you all have been well aware of. Nothing like New York City or major cities like that, or even places in California. But we've still had a surge in our area as well. We think the government needs to put a vax in you to control you. You need to get a moderator. Yeah, I haven't gone live too much. I don't even know how to set up a moderator, to be honest. I guess I could add somebody. I don't even know who would moderate, though. And what is he ignorant towards? I didn't see that comment. He's been on here saying a lot of stuff. It's very alarming to know people as ignorant as you exist in our medical community. Well, you can think what you want, man. Again, you can say what you want. I'm just telling you where I've trained at, that I've studied essentially my whole life to be a physician. I'm seeing COVID in person. I have friends that only practice in the ICU that had training with me, and some of them were in New York City when this first hit. Some of them are across the country. A lot of them are now in Florida, where they're seeing significant case rise. So, you know, you can say what you want about me being ignorant in the medical community. I'm still going to go to my job. I'm still going to go out and help people the best I can, and I'm not going to stop whether you think I'm ignorant or not. So, because I have multiple forms of chronic illness. So, yeah, that's the thing. For individuals who have comorbidities or take immunosuppressant medications for whatever reason, or are just immunocompromised to begin with, transplant patients, etc., they're going to have issues with getting infections, and they also might not have the same response to the vaccine that gives them the level of immunity that they need. I got Moderna, but 2 days later I had 102 temperature and had to go to the emergency room. Yeah, and that's the thing. Some people will have a reaction to the vaccine, and it's not going to be as bad as getting COVID for that individual, most likely. The idea is that your body has revved up to start making the protein, the antibody, to protect you from the infection. Now, if the infection had taken a hold of that individual, most likely they probably would have been somebody that would have been pretty sick from it. Does the vaccine protect from this new round? As of now, it seems that it does. It's slightly, I mean very slightly less effective. It's not quite as good as it was against the alpha variant, but it is way better than not being vaccinated, and it's not that much worse in terms of protection. So for the most part, it will be helpful. I'm a non-responder to MMR no matter how many times I get vaccinated, never have antibodies. So for the MMR vaccine, it is going to be different than the COVID vaccine in terms of the delivery mechanism and how your body responds. So with the mRNA vaccines, what essentially will happen is they expose you to the mRNA segment that will go into your cells. It does not go into the nucleus. It does not alter your DNA. It doesn't even enter the portion of the cell where that can happen. And this is RNA. They're not the same thing. It goes out to the ribosome in your cell. Then that churns out the protein to make your antibody. The whole idea of the mRNA mechanism is that it bypasses the beginning phase of most of vaccines. So a lot of times vaccines had historically been a portion of the surface of whatever the microorganism was. So then your body has to go out and recognize it. From that recognition process, makes the mRNA to then make the antibody. With this vaccine, it forgoes that whole first step. And that's likely a portion of why somebody might not be a responder to a vaccine. If you can eliminate a portion of that pathway to get to the ultimate goal of making the antibody, then your chances of having a non-responder become lower. But again, nothing's 100% effective in medicine. It's just not. But with these vaccines, especially Moderna and Pfizer, they're very effective, 95% at least. And it might be just slightly lower, a couple of percentage points lower against the new Delta variant, but still very effective. And I forgot earlier, somebody asked me what shot I got. I had Pfizer, and I got mine back in, my first shot was in late December, and my second shot was in mid-January, and I haven't gotten a booster. At this time, I don't think I will be getting a booster because I'm not immunocompromised. Until I see any research that comes out that says that the immunity from the first shots, the research that came out a couple months ago from the first batch saying that at 6 to 8 months, there was pretty good and very strong, long-lasting immunity from the two major ones, Pfizer and Moderna. So at this time, I don't see a need to get it. But if a need arises, they start to see evidence that the vaccines are not quite as effective the longer you go out, then a booster might be warranted. I'm getting my 4 and 6-year-old vaccinated as soon as possible. And I would agree with that. Again, case by case basis, though. I'm not here to tell individuals what to do, but I genuinely believe that for the most part, the benefits are going to outweigh the risk for individuals. That's the question. Why get the vaccine if you can still pass it? So this is I kind of just I think I already answered this. I don't know if you were on when I had answered this. The idea is that it's a numbers game. It's a percentages game. It's not a we don't get it because you only get it because it's 100% guaranteed to protect yourself and prevent 100% chance of spreading it. The idea is that it's the law of large numbers, it's the law of probability. The lower we can decrease our chances of the individual getting infected themselves and being significantly harmed, as well as their chances of spreading it to somebody else, that's how we're going to get through this pandemic. 77 COVID patients in the hospital right now, 72 unvaccinated, 39 ICU, 25 on bed. That's basically what I've been hearing from essentially all of the people I've been talking to, and it's truly sad. People are losing their lives. It's not a joke. It's not a hoax. It's real. It's here, and it's been here, and people's family members are dying, and you can see these numbers, and it's not even a situation where people should be saying "I told you so" and this is what happens if you don't listen. We're not here to do that. We just want people to get vaccinated to protect themselves. Husband and I are fully vaccinated. I'm glad to hear that. Respect. Sorry, but I can't. God bless all the people who are vaccinated, and that's fine. Sunny0608. That's fine. Everybody's entitled to their opinion. I'm just trying to give people what I believe is unbiased information, because I think that there are a lot of, especially the mass media, have their own spin on it. You don't know who's really behind it, what their agenda is. This is just coming from someone who's seeing things firsthand, and also who trained at a place with a very large anesthesia critical care class, who's got friends, colleagues all throughout the country, and basically a lot of the major cities. And then, like I said, New York City when it first hit. Now I have friends down in Florida in the ICUs, and they're just getting bombarded again. You have a lesser chance of being hospitalized and developing severe complications. That's absolutely true. Vaccine protects against a new round of the pandemic. Yeah, so I don't know if I maybe got flipped back up further in the comments or not, but yes, like I said, very small percentage point decrease in effectiveness, but still very, very, very high rates of protection from the Delta variant. Let's see here. Why can't they test for the Delta? I'm not quite sure. You mean to determine the variant? So the testing that you do in a hospital is not equipped to determine the difference between the two, but certain specialized tests for send-outs can. Like at our hospital, when we test patients that are coming in for surgery, we just see whether they have COVID or not, because it can impact whether our anesthesia machines get infected and if it can be passed along to somebody else in that route. And we have to go through certain measures to either reschedule them, or if it's the case they can't wait, putting special filters on our anesthesia machines to prevent the spread to another individual. Now, why can't they test for Delta? I'm assuming it's just extremely expensive. It's a very specialized test to differentiate between the Alpha and Delta variant at this time. Now, if somebody knows differently than me, go ahead and correct me on that. But where I'm at, we're checking to make sure the person does not have COVID. And from there, we decide how we're going to manage that patient in the perioperative setting. But there are ways to tell the difference between the two with specialized tests. But for the most part, the ones that are out in the community at most of the hospitals, it's not as complex. It's probably a cheaper way of discovering and diagnosing COVID than Delta, and then differentiating it from Delta. So let's see what else. It's not going away ever, and I think it's getting worse. I hope that's not the case, and I kind of alluded to that before with the whole idea that while it has changed, it hasn't mutated extremely quickly. And what my thinking on this would be, and now this is purely speculation. I don't think anybody can answer this question, but this is just my theory on it, is that because it's mutating so slowly, that once people have become infected with it, the ones that decided to become unvaccinated, and hopefully they have somewhat of a long-lasting immunity from it, but doesn't seem to be the case that it lasts very long. Um, Between that and those that get vaccinated, that eventually, once it's made its round of infections and we have enough people vaccinated, that it will slowly not have any new hosts to go to, unless the vaccine, or not the vaccine, unless the virus has a significant mutation to where a vaccine is not effective, like the flu annually. But because of how slowly it's been mutating so far, I think that the virus will hopefully go away. I can't say soon. I don't know the exact time frame, but it could be within the next 12 months. If vaccines are thoroughly accepted, taken, and or people have lasting immunity from an infection, then there will be enough immunity within our country as well as in the whole world to try and prevent there from being enough new hosts for that same virus to go to. And that's the idea behind it, about getting the vaccine out there to try and reduce, again, not eliminate completely right now, reduce the chances of new hosts being exposed to it, new viral replications occurring, and new mutations that can occur. It's all a numbers game. And that's what I've been trying to stress. It's not about trying to, it's not about doing what's 100% effective. It's about doing the best we can to do the most good that we can. Vaccines fine, mandated no. Already happening here in Australia. I can't speak about Australia. I don't know what they're doing. It sounds like obviously you probably are from there. You know they're being mandated, um, and I don't. That's an ethical question in terms of, is somebody's right to privacy or their choice more important than the greater good for the society when people are dying at the rate that they are. Again, it's a risk benefit. I can't say that people should be forced to vaccinate. I don't think that will be the case here because we already have individuals that forego other forms of vaccinations. But the whole idea of places possibly requiring it, especially private businesses, that's 100% up to them. It's their place of business. They're also at risk too of contracting it, and they don't want to put themselves in harm's way, and they're entitled to do that too, just as much as somebody's entitled to not get vaccinated. So I'm not on here to shame anti-vaxxers or people that are against it. People are allowed to do what they want. Again, I'm just trying to tell you what I'm seeing, what colleagues of mine are seeing around the country with this current wave, and give any advice or information or try and explain things when people have questions for me. I'm scheduled to get my third dose soon. Great. I'm glad you're getting your third dose for you. I had COVID before it was even a nap. Oh, sorry, I lost your comment. How does the per 1,000? Sorry. I'm getting a lot of comments, so I keep losing my spot. Okay, so um, my wife works for a gyno, and he had to deliver a baby in the waiting room because they have no beds left. And I'm sorry to hear that that happened to that individual. Hopefully everything went well with delivery. But the craziest part about the whole thing is we're just at the beginning. We have a whole new population set that's going to be significantly affected, and that's the pediatric population. They're going to be the ones that are going to start to be able to spread it because it's more contagious, and unfortunately, it seems to be making them sicker. So I don't want to see the children start showing up to the different hospitals. Then also, we don't have the same level of resources for children as we do for adults. We have far more adult ICU beds in this country than we do pediatrics. So when you have children showing up to hospitals not being able to get into the ward that they need to go into for treatment, that's when it's going to be really scary and sad too. Particularly because the children either can't take the vaccine, or if they're old enough, were not allowed to take the vaccine because of parental guidance. And I'm not shaming those parents. I'm just saying it's a numbers game, and this is the way it's looking right now. How can we increase our immune system in a short period of time to try and fight COVID if we get? I'm assuming you're gonna say if you get it. I don't think there is one. I mean, obviously, eating healthy, and all of those things are going to be beneficial. Getting adequate sleep and rest, basically all the preventative things you should kind of be doing anyways will be helpful. But specifically, once you've contracted COVID, it's again, it's a numbers game. Some people are just going to be asymptomatic or have mild symptoms. Other people are going to progress. And the scariest part is it's really hard to determine who's going to respond in what way. So if you get COVID, the only thing you can really do is symptomatic treatment, especially if you're talking about if you're at home. Any over-the-counter stuff that people are touting or trying to sell to you is likely going to be ineffective for you at best, if not harmful. If you haven't had COVID already, do you need the vaccine? Oh, if you have had COVID. So I talked about this earlier. You still would benefit from getting the vaccine because you don't know how long your immunity from the infection is going to last, and having antibodies resulting from the infection is not the same thing as having antibodies resulting from the vaccine. And I commonly use the example, and I said it earlier, the tetanus vaccine. If you get a tetanus infection, you get what's called a sub-immunologic response, meaning your body gets symptoms, gets overwhelmed from the tetanus toxin, but you need to go get treatment for it. You're not going to have enough of an immune response from that to prevent you from, one, dying from the tetanus infection right then, but also from a future tetanus infection. You're not going to be immunized from it. So the idea is that the immune response from a vaccine can, in a lot of cases, not a lot of cases, in some cases, but particularly for tetanus as well as in this scenario COVID, the vaccine will give you a more robust response and a longer window of immunization following the immunization shots. Quit fear mongering. Annie, I couldn't read your name. It jumped out of there. Annie, I'm not trying to fear monger people. I'm only trying to say what I have seen in hospitals, what my colleagues who are dispersed all across the country who I worked with in residency are seeing, including people who were in NYC when everything broke out. And these aren't just private practice docs who weren't in hospitals. These are ICU physicians. And now I have some in Florida that are down there, and they're getting overrun right now. How can Wyoming have 153 per? Let's see here. Let's see. Tell the truth. What's in the vax? I mean, you can look up what's in the vaccine. I mean, I don't know why this question keeps coming up. There are plenty of people that are trying to say that there's harmful things in vaccines. The data just doesn't support it. I mean, not even just this vaccine, but the older vaccines where people were talking about its connection to autism. That thiomersal was the thing that was pointed at as being the problem, and that has been. First of all, thiomersal hasn't been in vaccines for decades now, so that's not even a legitimate argument anymore. And also, the studies that were continuing to occur showed that there was no correlation between it. Explain the deaths. 15-year-old heart attacks after the vax. So I don't know about this exact example, but for example, so when you're talking about reactions to a vaccine, you're also talking about percentages. You're going to have somebody who might have something happen. Either it's a coincidence, they were going to have the said heart attack anyways. I know they're 15, they were low risk. They may have had that anyways. But if it is due to the vaccine, you have to weigh that against all of the other children that will be affected. Because, for example, your example of a 15-year-old having a heart attack after the vaccine, what about the healthy 13-year-old who died from COVID in Mississippi? Not overweight, no comorbidities, no reason to have died, but she died. And you're going to hear far more about the individuals that have gone to the hospital and died from COVID than individuals that are going to the hospital and dying from the vaccine. When have you seen a hospital overrun from people being treated and dying from receiving the COVID vaccine? That's all I'm going to say. Has RegenCo helped any? To my knowledge, no. I mean, all the data on all of the medications, the monoclonal antibodies, all of those things have really not been shown to be that that beneficial. And to date, I don't think anything has been shown to help with mortality at all. If it's this bad, why are schools okay with children going back to school? That's public policy. That's outside of anything I can control, or I'm not sure. I think that there are a lot of people were fed up with people being stuck at home, homeschooling. Um, Also, the financial implications. It's tough to say that, but there are a lot of families that are dual income families, and they don't have anybody to watch their children, so they have to make a tough decision on whether they go stay home and have trouble paying their bills, or they stay at have to find somebody to take care of their child while they both go to work. So it's really tough. Where did the flu go? I'm so glad you asked that. So again, it's a numbers game. We did things in 2020 that we have never done in the United States for preventing the spread of viruses, not just COVID, but viruses. We were masking, we had lockdowns, we had a record number of flu shots given that year. So you're talking about um, a year that is an anomaly compared to the other ones because of the circumstances that happened during it. Now we're going to start seeing flu again as people have been going back to work, traveling, all these things. You're going to see the flu again this year. You're going to start seeing RSV, all these other viruses that there's a reason they're called communicable viruses, and it has to do with how many hosts come in contact with each other. And that numbers game was in our favor last year for the flu. And that's basically why. Why are so many nurses and doctors quitting? And wait, I'm in Florida and the hospitals are normal. Why are so many? So I can't speak to all of Florida, but there are several ICU physicians I know. One's in Jacksonville at a large hospital, and she has already spoken about how their ICU physicians have not just been burned out by the initial waves, but now the current wave, and their ICUs are running out of beds. There's pediatric ICUs in Texas that are running out of beds, as well as just the regular adult ICUs. FDA recalled PCR. Yeah, so that's just not true. There was one PCR test. If you go and actually read the full articles on that, then you will know that that one test was implicated as having problems, but the rest have not been. Otherwise, it wouldn't make any sense. So I keep talking to all these people about how you can say what you want about agendas and fake tests and hoax. Then what's killing people? Something that perplexed the entire medical community, all of our medical science, all of our testing, and for some reason, their people are still dying from something. So whether you want to believe it's COVID or some other conspiracy or just whatever you want to say, there was something that we couldn't explain that has been killing a lot of people until we had these other tests that came out. So my credentials, I saw somebody asked. I did my residency in anesthesia and critical care medicine at Johns Hopkins University in Maryland. So I spent my time there taking care of patients for significant, high complicated complexity surgeries, and spending significant time in the ICUs there. I was there before COVID, but still received my training and it's not rated the #1 anesthesia and critical care medicine um, residency in the country. So, and I'm not trying to sit here and brag. I'm just telling you that that is where I received my training from, and I've always done extremely well on board exams and things like that. I would consider myself a stand-up person in terms of taking care of patients and being a competent physician. People can sit here and say disrespectful things if they like. That's fine. Let's see. This guy wants to jab your kids. I don't know where that's coming from. Okay. Why are people who have the antibodies being disregarded? I'm not. Let's see. Who said that? Red Fairy Love. I'm not sure what that means. Why are people being disregarded? If you could please explain your question further, I'll be happy to try and answer that for you. You need to research outside of what is being told to you. Are you telling that to me? I'm research out of what is being told to me. I'm not being told anything. I'm seeing this firsthand, and I have friends that are seeing this firsthand and have been seeing it for the pandemic. So I don't know. What is your counter argument to that? What have you seen in person? Have you been in the ICU or have friends across the country at all of these places that people aren't getting sick? I mean, I honestly can't believe anymore that people think that this is a hoax. I'm not here to push the vaccine on people, and I've said that before. I'm just here to talk about what is going on in the country right now, my thoughts on the vaccine, and to help people with answering their questions. So, tell you where the flu went. I just did. And University of Facebook. That's fine. You can say what you want, man, or woman. I'm not sure. I don't know who said that, but you can look up who I am. I'm a physician. I'm all over the internet. Not all over the internet. I'm on the internet. You can look up my residency program, class of 2018. I'm on there. Feel free to take a look. Do you think we should get the shot? I My flu argument is a lie. I don't understand how that's a lie. You can look up the vaccination rates for last year for the flu. You can look up, I don't have to look these up, but you saw the mandates that came in effect during the cold and flu season. I don't understand why that would be a lie, but feel free to comment below. Oh, I see what you're saying. You're just Facebook to people in the chat. The flu didn't go anyway. They test positive for both. Not a hoax, don't believe it. Just don't want the jab. It should be my choice. No, and that's what I keep saying. It is your choice, and it's a risk benefit for everybody. I think that in my personal as well as professional opinion, that people are going to benefit far more from the shot than the risks. The risks of a side effect from the vaccine are extremely low, particularly compared to the risks of those that are dying from or having significant complications from the COVID infection. Your risks from getting COVID are far higher. This EO thing, the EO thing on the swab. Yeah, so that's a sterilization technique used on, so when things are sterilized and put in sterile packaging, their idea is not to have any microbes on the device when it is utilized. So, for example, this swab. So the guy who was on TikTok talking about the EO going into his nose, what he fails to realize is that the solution is placed on there and they have to at least identify it on the label, but the amount, the concentration of that substance is essentially undetectable on it after it has been cleansed and evaporated off of the swab. What do you think about antibody dependent enhancement with this vaccine? I don't know what you mean by enhancement. I mean, I guess you mean the response. And actually, yeah, if you could clarify, I haven't read on antibody-dependent enhancement in particular. If you mean the response to it, I think that the response to the vaccine is robust. I appreciate you in science. Any advice? Any advice on someone with hypochondria, scared to get the vaccine as well as COVID? So I'm sorry you're suffering from hypochondria, and I know that that can be very scary for you. Again, it's an individual basis. You got to talk to your physicians, and look at your own medical conditions, and figure out what you think is best for you, and um, weigh your risks and benefits on an individual basis. If you think that you're going to benefit from the peace of mind as well as the actual immunological protection, then go ahead and get it. If you don't think it's going to be right for you, then maybe not get it. I still think that as a society, it's in the best interest for people to go out there and get their vaccine. It's a cancer causing. Yeah, so I know that it's a known carcinogen. But the problem is that it's not found in any type of significant amount. There's barely anything on the swab. There's no residue of that substance left on the swab when it comes in contact with the patient. For example, we always hear about substances like formaldehyde that are in that are in certain foods or diet sodas, things that get broken down, aspartame that can get broken down in formaldehyde, all these things. But people fail to realize that it all has to do with the amount of something. We have normal, completely normal physiological and biochemical reactions in our body that make formaldehyde. And if 03 Boom Boom is still on here, he can chime in with his major or master's degree in biochemistry, and he can talk on that, how formaldehyde is something that's normal in our bodies. It's not in high concentrations, and people think that formaldehyde's bad because it's used in embalming fluid for cadavers or when people pass away, and it's used as a preservative. But that's in extremely high doses, way higher than what we have in what things we're exposed to or what our body does with certain chemical reactions. So just because something sounds bad or you associate it with something bad doesn't mean that it always is. Now, you should be cautious and always read on something or ask a professional about it. But at the doses or the exposure to things like the formaldehyde seen in certain substances is usually not enough to cause any type of issue. And then for this EO agent in the nasal swabs, same situation. Do you think it's worth the risk if you have natural immunity? So that's a personal thing. I do believe it's worth it, and I don't know when you got on here, Patriot Mom 00, but I did discuss that you do get a longer lasting and more robust immune response from the vaccine than just having the infection. Now, you still have some antibodies, and you're likely protected, but I don't think anybody can really tell you for how long. I think that there were some studies initially that showed about 3 months that the natural immunity starts to wane some. Now, whether you might be susceptible to reinfection from the alpha or maybe even more susceptible to the delta variant after that time frame, it's possible. Your natural immunity might be still remain relatively high, but the response from the immunizations and vaccines are much better. Our opinion on people skipping second dose due to scary side effects. So I would say definitely don't do that. The second dose, actually not usually, some people will have a worse reaction. Some people I know, and I say I know because in healthcare, a large amount of people in the hospitals I worked in, as well as other people have told me, had a worse reaction with the first shot. And it was, I don't mean worse in terms of something that was catastrophic, just they got their arm soreness and fever from the first shot and didn't get anything from the second shot. I was the opposite. I didn't get anything at all the first time. The second shot, I got some soreness and some mild muscle aches and a low-grade fever. So I wouldn't be afraid of it, but you're also not getting the full immunity. Look at Europe. I believe it was the UK who their idea was trying to get one shot into everybody. And they did relatively well with the alpha variant trying to get a baseline herd immunity. But the problem was when the delta variant came out, they realized that not having the second shot with that extra bump up in immunity in terms of the level of antibodies, that they were starting to see another uptick that was affecting even those that had received one shot. So completing the course is in your best interest. Doctors don't care if you have antibodies. They still want you to get the jab. Why? I was just kind of explaining that. If you're having antibodies from the natural immunity, it's usually doesn't last quite as long, not quite nearly as long. I mean, most of the data we have so far on vaccines is that 9 months at least of 8 to 9 months of immunity from those that have taken the shot initially when it first started coming out, or those in the trials. Now, for natural immunity, there are some studies that were showing within 3 months or so your immunity started to wane. I don't want to say it was gone. You might still have some immunity, but it's not as robust. And I'm just going to scroll down here. I'm up here pretty high on my comments here. I have been vaccinated. Should I still wear my mask around my new grandbaby? I personally would. It'll make you feel better. It'll add another layer of protection for the young the young baby, particularly if you said they're a newborn or very new. Well, first of all, congratulations too for that. But you also have to be cautious because the young baby can't be vaccinated. Um, you might have, hopefully you're a responder to the vaccine, but you could fall in that 5% who did not receive, who received the vaccine but didn't get an adequate response from it. So you also have to be very cautious with thinking that you're completely immune and not going to be able to spread it. And even if you do have immunity, there is a small chance that you would spread it if you had a significant infection. Now, like I said, it's a numbers game. You likely won't have an infection, a significant infection, and your chances of spreading it are relatively low if you're vaccinated. But the idea is that it is a number and statistics game, and anything you can do to lessen your chances is what we should do. Nurses aren't as educated as doctors, but people educated with PhDs are the most reluctant. Why? People with PhDs are most reluctant with what? The vaccine? Is that what you're getting at? I would assume, and there are some people that are cross-trained. I had friends in my training that were MD PhDs. They did receive both a medical doctorate as well as a PhD in, I don't know what their PhD, I'm assuming some type of medical subspecialty for their doctorate with that. But what I'm trying to say is most individuals that only did a PhD in something, microbiology or whatever it might be, they're not seeing patients clinically usually or in the hospital. So they're a little more withdrawn from it. I don't know in particular what you're talking about in terms of who these PhDs are that are afraid of it. But if you're not seeing the cases firsthand, you're not seeing the suffering of certain people, then you might be less likely to want to be motivated to get vaccinated. But I can't speak to individual PhDs or the group of collective PhDs you're talking about. I'm not quite sure. Bassett Mama, paid TikTok doctor. TikTok is paying doctors and nurses. They tried paying my friend as a nurse. I'm not paid. I don't know what else to tell you. I mean, I'm a content creator. I get paid for videos just like everybody else's views, but I have not been sought after by TikTok to say anything. This is literally just me. I'm actually just got home from work. I'm still sitting outside on my phone doing this so that I can help people. But you know, you say what you want. I'm just here to try and provide people with information. Let's see. Got first shot, scared for second, pins and needles, muscle weakness, 8 weeks, help. Well, the one thing I will say, I'm sorry that happened to you, and I hope that you don't have an issue with your second shot. So far, and I haven't seen personally somebody who's had a bad reaction to both shots. Usually it's for some reason one versus the other. But yeah, that's true. Yeah, we would be out of crippling student debt if you got paid for this. That's absolutely true. Yeah, that's definitely true. Let's see what else we got here. Why are the pamphlets inside the Moderna vaccine blank? No information at all with the Johnson. I can't speak on that. I had Pfizer. I don't know. I haven't seen their vaccine information. My Pfizer one was filled out. I'm not sure. Thanks for your excellent information. Level-headed delivery. Continue to ignore the detractors. Thank you, Riley D198. Yeah, I'm just here to help. People can say what they want. If they can say names, I'm just here to help. It's not the first time I've been called names, so it is what it is. Let's see. My friend died 2 days after his shot. The second one went to work and it dropped in. Well, I'm seriously sorry to hear that. I don't want bad reaction to the vaccine, but especially death. That's just awful to hear. And I don't know what the cause. I mean, the vaccine may have played a role in it, but I mean, I don't know the exact cause. Was it a blood clot? Did he have some type of heart arrhythmia or some reaction that happened? Was it anaphylaxis? But I'm sorry. I'm absolutely sorry to hear that happened to your friend, and to you. So much ignorance here. If people understood science and trusted it more, this would be over. And I'm not here to cause people to have names. I'm not here to call. I just saw somebody else's thing pop up. I'm not here to cause people heartache or bash people that aren't getting the vaccine. This is purely just to help people and give them information. If they still don't want to get vaccinated, that's fine. I'm just letting you know what's going on with the vaccines, and happily answer questions if you have any. Let's see here. What are your thoughts on Dr. Corey's claim on ivermectin? I'm actually not quite sure who Dr. Corey is. I didn't catch that one. If you could just write a quick synopsis on what her thoughts were. All I know is that ivermectin, and I said this earlier when I got on, but I've been on for a little while now, is that people are quick to use ivermectin or think that it should be safe to use because it's been around for a long time. But the idea is that, or the rationale for using a medication just because it's old doesn't really hold water, because the medicines get better and better over time typically and get replaced. Ivermectin is not a medicine that people typically are exposed to. I mean, it's used for parasitic infections and it's rarely given to individuals. So to say that you're going to use ivermectin because it's been around for a while, there is a long list of side effects for that. Injury to your heart, your liver. You can have seizures from it. It can affect your white blood cells. So there is a whole list of things that can happen. And honestly, you're more likely to have a significant reaction, particularly if you were to say, let's just give ivermectin to everybody. You're going to see much more reactions from that than getting a vaccine. So that's what I'm trying to say. Lung, Texan CEO. Lung, was that your response to what? Oh, here we go. There are 0. Let's see here. Texan CEO, I'm trying to find your other comment. Thank you for writing. I'm assuming you wrote something. What's your thought? You wrote that there. What's your thoughts on Dr. Corey's claim on ivermectin? There are 0 peer reviews on almost all meds being used. Yeah, there's 0 peer review. Well, the thing about peer reviews is that that's just a peer review. There are trials looking at these things done in critical care journals. So I don't know what you're talking about in terms of peer review. I mean, you can have double-blinded, placebo-controlled trials that have looked at a lot of these novel treatments that came out initially. They looked at Decadron. They looked at the monoclonal antibodies. They looked at ivermectin. They looked at hydroxychloroquine. And none of them had really any promising results. And I think the one that did got discredited. The only one that had any type of help, I think, was ivermectin, but it was very, very small, and it did not affect mortality at all. It didn't prevent people from dying. It only slightly decreased the severity, but it's much more dangerous. It's not nearly as effective as getting the vaccine, which the whole idea of the vaccine is it prevents you from getting infected at all. Not at all, but it prevents you from having a severe reaction to it and limits the spread of disease as well. It doesn't completely rid the chance of somebody spreading it, but it is far better than not having it done. There you see, man in Mississippi died taking ivermectin. So I don't know that exact case, but it's like, I'm sorry that person lost their life, but it's likely true. Somebody was bound to have a bad reaction to the ivermectin, and if you start using that wide scale, you're going to start seeing it more frequently. Big Tony 19500. I hope you have God in your lifetime. Okay, well, that's also partially why I went into medicine, was to help people, to reduce pain and suffering. So I don't know what that comment exactly means. All I try and do is help people each day. I go to my job, and especially if it's with surgery, I, as an anesthesiologist, help reduce their pain and suffering, and also with our knowledge from internal medicine and critical care, help people there as well. So I don't know what the comment you were talking about is inferring to. Also here, Dr. Corey is a lung and ICU specialist, been using it as a preventative in patients. I'd have to go and read specifically about what you're referring to for the ivermectin. But I will just tell you that ivermectin is pretty toxic medication. This is an example of when people are very quick to defend these other novel treatments, but aren't trusting of a vaccine. It's just kind of strange. And again, people are entitled to what they want to believe, but the medication is toxic. It is. Is it beneficial? At best, maybe marginally, but again, risk-benefit analysis, your risks from your complications and side effects from ivermectin are likely higher than any benefit you're going to have in terms of reducing severity of COVID or preventing death with COVID. India's largest state started using it as effective treatment and prevention. Lowers the chance of getting infected, though, anywhere from... I don't know what that was. Can you focus on the people that believe COVID exists? Yeah, sorry. So anybody who does have questions about specifically COVID, I'm happy to continue to answer. I'm sure people have been filtering in and out, but I think I've answered a good amount of questions so far, but I'm happy to repeat. So thank you for what you do. My grandpa's an anesthesiologist in California. Thanks, Jazz Roth 18. And also thanks to your grandfather for doing what he's doing out there. I hope he's doing okay. I know California, some areas were starting to get increased cases recently. What are the very rare side effects of ivermectin? So the very rare, not very rare side effects, but I don't want to say very rare because that makes it sound like they don't happen. They sound very rare because not many people are being exposed to ivermectin now, but if you were to expose a lot of people to it, the chances of them happening would be higher than the complications from the vaccine. But they are effects on your white blood cells. They can affect your heart. They can cause liver injury. They can cause seizures. So those are just a couple things. Do you think the Johnson & Johnson will do a booster? I don't know. I kind of touched on that earlier. I'm less knowledgeable on the Johnson & Johnson because I do know that it varies some from Moderna and Pfizer in terms of its effectiveness, so I haven't really followed that as much. I have Pfizer. Most people I know have Pfizer and Moderna. I still think Johnson & Johnson is effective, particularly for those that aren't high risk or those that aren't in the healthcare field, where they're not going to have high levels of exposure from critically ill patients having high viral loads of the virus. But I don't know if they're going to need a booster in terms of them versus Pfizer or Moderna, or even if Pfizer or Moderna are going to need a booster at all. From what I've seen, most of the longevity of the immunity from a response from those two vaccines, Moderna and Pfizer, have been pretty good. I'm not as sure about the Johnson & Johnson longevity, but I think they're probably about the same. Misleading chart. I'm not trying to cause fear with this chart, but you can clearly see, it doesn't matter whether the numbers are in thousands or millions, you can clearly see the correlation between unvaccinated, the blue line, and vaccinated. So if you have a large amount, I'm sorry, not vaccinated, but COVID cases, if you're having a large amount of COVID cases in those areas, and this chart, it's not all the information's in this one chart, you can go to these individual states and look at the percentages of those that are hospitalized and are unvaccinated. You will see that those states that have been clearly unvaccinated, large populations are unvaccinated, have higher rates of hospitalizations due to COVID. And then the ones that have done a little bit better down here have lower rates. And then if you go to these different states, you can see that the whole thing is that most of these states will show you that most of the people being admitted are unvaccinated. Why is full disclosure of side effects avoided on vaccines? I'm sorry. Were you the one that asked me earlier about the side effects of the vaccines? No, I thought you were asking about ivermectin. The very rare side effects of the vaccine can include myocarditis of the heart, rare blood clot, but they're very, very low. These are disclosed. They're on the sheet, at least the ones that we signed, and that my family members who aren't in healthcare, some of them, well, my brother is in healthcare, and my mom used to be, but she's retired, so she's just a citizen, civilian now. So she just signed the same exact waiver, or not waiver, but side effect profile that everybody else should have been given. So I'm not quite sure why you weren't allowed to see your side effects. That you should always have full disclosure provided to you before anything happens to you. There's more of a risk and side effects with birth control. Exactly. So the one thing that always comes up is blood clots from the vaccine. And while it's unfortunate when it happens to somebody, the main problem is that you're going to see far more chances of a blood clot for a patient who just had surgery and is immobile, for patients who are smokers, and for patients that are on birth control. Like significantly higher, like in the magnitude of 5 to 10 times as likely. And then you multiply that more people are probably on birth control currently than there were getting vaccinated up until maybe recently, that the chance of getting a blood clot you're going to see more blood clots related to those things than you are going to be from the vaccine. Breakthrough, much less likely to be severe. That's true. Now, the term, and I think it's tough right now to label things as breakthrough, because breakthrough also sounds like the vaccine might not be effective. To me, that's not how I would view it. Breakthrough, to me, should purely mean somebody who had an immunologic response with presence of antibodies, and then it wasn't effective. But I think a lot of what we're seeing that's being labeled as breakthrough is falling closer to that 5% of people that don't get an immune response or aren't considered immunized because they got the vaccine. And that's likely what we're seeing. Some of these people, we're talking about the entire country, 350 million people that could potentially have been infected. Now there's a lot less because either they had some infection and might have short-term immunity, or they've had the vaccine and have a little bit better immunity. So you're eventually just going to see things happening. The larger population that you get involved. It's the law of large numbers. You're going to start seeing things, more numbers, higher numbers of things, the more you do it to a bigger population. COVID is real. Go work in the ER. I mean, that's true. I mean, I don't know. Yeah. Oh, I'm sorry to hear. Penny for 3. I'm sorry to hear that your mom almost died from a birth control blood clot. That's sad. Bunch of sheepskins up in here. Bear effects. I mean, you can say what you want, man. I'm just trying to give out information about what is going on firsthand from patients' experiences in the ICUs, and also what colleagues I have. I went to a relatively large anesthesia critical care medicine residency, and I have friends located throughout the country that have seen this firsthand in the ICUs as well. So I don't know why you calling people sheep when things are clearly happening. So she's all good now, was a nurse and was in the hospital at the same time. Well, I'm glad she's doing well now. What about the 14,000 dead from this poison, doctor? I really enjoy your quotations around doctor. That's pretty cool of you. But anyways, poison, I don't understand why you think it's a poison. How many people have died from COVID? I mean, you look at anything, you introduce something new into a society, and you have the scale of the pandemic and how many people would be exposed to the vaccine. 14,000, if you're talking about that's the people that have died from the vaccine, how many people died from COVID or literally anything else is going to be higher than that amount, essentially. That is a very small number. Even if it's not the vaccine, look at any medication drug reaction, or how about allergies to food? There's probably more people that have died from peanut allergies and anaphylaxis. So coming on here and talking about poison from doctors, look at how many people are being exposed to the vaccine and how much good it's doing compared to the risk. And I'm not saying you're not entitled
to have your opinion, you are, and that's fine. But trying to just put out a number, 14,000, is a lot, and that's a sad number, but you also have to look at everything comparatively. Proving that Ike is empty where they've been. I don't know what. Oh, ICU's empty. I mean, and I can't comment on the entire United States, but I will tell you that people that I know have seen their ICUs be overrun. The ICU at our hospital has been overrun in previous waves, and we're starting to see another uptick of it now. That's all I'm trying to say. I can't justify or validate what some mass media source that you saw may have said. Let's see here. What is your degree? A BA and looking like Charles Manson. They are discovered within 3 months of trials. Extensive studies on this. Thank you for all your help. Well, you're welcome. I'm glad to help. I hope that me coming on here has been helpful. What about the long-term effects of the vaccine? I did a live session yesterday, and somebody asked this. I'm happy to answer it again. So I don't think that there's going to be long-term effects. Now, I'm not going to sit here and say I know for sure, and I'm not going to say that anybody can tell you for sure there won't be anything that happens. But the reason I think that it won't is because essentially all the substances in the vaccine are eliminated from your body within several hours or within a day. The mRNA goes into your cells, tells the proteins to start being developed to make the antibodies. After that process has happened and your body also has memory from your T and B cells and the rest of your immune system, then those can lay dormant and be ready to act up or wake up when you are exposed to the virus. So, but that being said, most of that stuff has been eliminated from your body. People are talking about cancer and alteration of DNA, and that's just not how the vaccine works. This vaccine has a very short segment of an mRNA message that goes inside the cell, goes to the ribosome that makes the antibody. After that, that piece of mRNA gets degraded over the next several hours or day. So really, it's not that much of a chance of somebody having a long-term effect from it. How are folks doing that got vaccinated that had COVID bad prior? So I guess your question is patients who were severely ill from COVID and recovered and then are vaccinated now. So I don't know the exact numbers. Like, I don't know if there's been follow-up on those individuals that may have had an ICU admission, but getting vaccinated, and I've talked about this before, will give you much better immunity compared to just having the natural immunity from the infection itself. And I think I've said it twice now. I've been on here for quite some time though, but that the tetanus infection that you get, the toxins will accumulate in your body and cause you to have symptoms before you have immunity from it. So you'll get sick, have all the effects of the tetanus toxin, need to go to the hospital to have the antidote given to you and treatment before you will have an immune response. And you definitely will not be immune to another exposure to tetanus toxin. So, but you do have a lasting effect from the immunization. And that's the idea with COVID. It's not quite as significant. You do have some natural immunity from the COVID, but when you have the immunization from the shot, your response is more robust in terms of the level of antibodies as well as the duration or longevity that they stay around for. Let's see here. Like the flu, mutates like the flu boosters every year. So we'll see how it plays out. And I talked on this a little bit earlier. So the thing about mutation is that while there is a mutation, it doesn't seem to be significant in the sense that the previous vaccines that people have had are no longer effective. Think about the flu. The flu mutates in basically like a 9 to 10 month time frame, maybe 11 months. And then each year it starts to pop back up. And then it's really intensifies into the winter months, and they have to try and figure out or guess what that next month's going to be, or next year is going to be, so they have to start making the vaccine ahead of time. So when you get your flu shot, sorry, what is this one? So what I was trying to say was, with the flu, each year we get a booster because the prior year is no longer effective. I mean, it's essentially zero. Very, very little overlap because of how quickly the flu mutates. Whatever antibodies or memory that your immune system has, it would not be effective if you got re-exposed. The good thing about COVID so far is that it seems to be slowly mutating. I know there have been a couple of variants that have been listed, but in terms of the overall effectiveness of your vaccines, we haven't seen a significant decrease. I mean, think about it this way. These cases started, at least reported, late December or early January between 2019 and 2020, the ending of that year and the beginning of that year. And since then, we've seen the change, a couple of variants. Now we have the Delta variant. But the initial immunization, the vaccine, seems to still be very highly effective. So my hope, and again, I can't back this statement up, is that between some people having natural immunity and people getting vaccinated, that eventually we'll get to a point where the virus is starting to have less and less hosts to go to, and unless it has a significant mutation, and you can look these up, there's something called an antigenic drift and an antigenic shift. And what happens is, and this happens with the flu very rarely, this is what happened with the Spanish flu. So you have an antigenic drift, meaning it's a slow transition. There might be some overlapping immunity from the last year, and the flu shot that's coming out for the next year will bridge the gap in immunity. But when you have an antigenic shift, it means it's a completely different, no previous immunity at all, nothing's helpful. It's a brand new virus essentially. That's when you start to see the high death tolls that happen with the Spanish flu. Luckily, we haven't seen that with COVID so far. There have been changes. I'm not saying that it hasn't mutated some, but thank goodness we haven't seen a very, very large change so far. Are we past the possibility of herd immunity? I don't think so. I don't think you ever really, I mean, in terms of the short term, yeah, I think that we're going to hit a wall here soon with schools reopening. And getting back into the winter months, especially with people going back to work, we're going to see another peak here probably. Hopefully it won't be as bad, because hopefully all the elderly and high-risk individuals who likely would have ended up in the ICUs have sought after the vaccine. But in terms of having the goal of 70+% immunity across the board, to the point where those that are not vaccinated can walk around and do what they want because the rest of the herd is protecting them, is not happening. I mean, look at the situation now. It's just not happening right now because a majority of individuals that are getting admitted to the hospital right now are unvaccinated. I'm not saying that vaccinated people aren't being admitted. There are occasional vaccinated people, but look at the given states. The overwhelming majority of people getting admitted to hospitals, particularly those in the ICU and getting on ventilators, are unvaccinated. And that's showing you that herd immunity is not there yet. Because if we were, then even the unvaccinated people would be protected. My state is letting parents choose online learning, in-school learning. What do you recommend? Again, that comes down to what works best for you, your household income setup in terms of you and your partner, and availability to help out with the kids and somebody to watch your children, income situation, dual income, in terms of safety of the children, what's the vaccination rates in your area, what's the COVID case rates, mask mandate versus no mask mandate. It's really hard to say on what can be done if you truly don't want your child exposed, particularly the fact that the Delta variant does seem to be a little bit more affecting children, unfortunately, in a more negative way than the Alpha variant. And you have the option to switch. I don't see any reason, if you're able to do it, why you might not be able to keep your child home for online school to start with, and then transition over if in the event that Delta starts to play out as not being as significant. But so far in the beginning, it seems that it's affecting children more. Pediatric ICUs are starting to see more cases and more hospitalizations. So it's really, I don't want to give you the wrong guidance. I don't think anybody can give you the right guidance. It's really going to be your decision on what works best for you and your family, considering all of the factors. So it's tough. What about getting vaccinated after exposure? Aren't they still suspect for the variant with the... So you're not... So the variant is still... You're still very protected against the variant with vaccination, particularly Pfizer and Moderna. Again, I haven't read as much on the Johnson & Johnson stuff, because when it initially came out, it was only 70% effective, and a lot of people in healthcare and other places were doing Pfizer and Moderna, and that's usually the information I see coming through my medical emails, accounts, and journals that I see information about. But for the most part, the variant it's still effective. It's not quite as effective, but it's only a few percentage points off. So like 95 to 99% for Moderna and Pfizer for the Alpha variant, likely 90% plus for the Delta variant. So you're still going to get good immunization and vaccinations from that. You're welcome. All right. Well, I'm going to actually at home now, so I'm going to head inside. I want to thank you all for joining me. Oh, sorry. How you approach a patient who's afraid of this vaccine? I try and talk to them and hear what their thoughts are on it and what their apprehensions are. And that's just me in medicine in general, not just the vaccine. Some people have these preconceived notions or fears of something, and as long as they can get information about it, then they can be reassured. Then they might be more willing to do it and feel better about it. But for those that really don't want to do it, I'm not going to force anybody to do it. I want what's best for my patients. I want what's best for the community. And that's kind of how I feel about it. I'm not here to twist somebody's arm, but I do think that people should get it. What if you have had COVID already? And you may have just logged on. We kind of talked about this a few times now. The immune response is much more robust, and you get better longevity for how long your antibodies stay around getting the vaccine versus natural immunity. And this is true for other vaccines too, and I've said this earlier, that, for example, tetanus. You get tetanus, you get symptoms, but you don't mount an immune response to it. That's a little different. You don't get an immune response essentially at all. You have to go to the hospital to get treatment, you have to have your tetanus shot, and you don't have immunity from being infected for tetanus. COVID's different. You do get some natural immunity from being infected, but it probably only lasts a few months. Not on the scale of 8 to 9 plus months like you see with vaccination. I'm scared and get so much hate, but you are changing my mind. Changing your mind about how you talk to patients or people getting the vaccine. I do appreciate the honesty as someone who is hesitant. Yeah, I mean, I'm not here to try and convince you. I'm just trying to give you all the details, because there is a lot of misinformation out there, and people trying to cause people to be afraid of the vaccine or other people about getting vaccinated. Yeah, so you're in the same boat as somebody else who just talked about this. I just think that people got to do what's best for them. And I see that you says you're CRNA. So if you have any comorbidities, and the fact that you're doing aerosol generating procedures with intubations and even managing patients with COVID, you have your N95, and that's always helpful. But getting vaccinated is going to be your best bet. And if you have any comorbidities or reasons that you might be prone to getting severe COVID, it's probably in your best interest to do it. But again, I'm not trying to convince you. That's just how I approach stuff. I try and think about it on an individual basis and what works best for the individual, considering all of their risks. So if you get vaccinated, great. I'm vaccinated. I had Pfizer. My first shot, no thing. Second shot, I got some body aches, some mild shakes, and a low-grade temperature, and then I was fine like a day later. When are we going to get the third dose? So I'll have to continue watching for articles about that. The last thing I had seen was that they were only going to be recommending it for those that are immunocompromised, because they likely didn't have enough of an immune response the first 2 shots, so they probably aren't going to last with their immunity for as long. So the third dose. I'm not planning on getting it at this time until there's information saying that I need to use it. I'm not going to take a vaccine from somebody else who needs it when I'm already vaccinated. And all the data that's come out so far, for those that are healthy and had a good immune response, is that it lasted for 8+ months of strong immunity. Do you plan another live? Yeah, I mean, I'm trying to do more lives pretty frequently. So once a day, I try and do them on my way to and from work. This one's stretched over a little bit. I only have a 15-minute commute from the hospital I'm at currently. So I've stayed on here a little bit longer to talk. But I'll be doing lives. If you would like your friends to come on, you can always invite them as well. But I'll probably be doing some pretty soon. I just got my second dose like 3 hours ago. When did you feel effects? So I'm trying to remember correctly. I got mine on a Saturday because I knew that I might get side effects. I got mine around, I think it was 10 a.m. And I made sure to have Sunday off because I wasn't on call that weekend. And then I started to get the low-grade fever and body aches around like 1 in the morning. So it was a little over 12 hours. So about 12, what did it make that? 15 hours maybe is when I started to get symptoms. My wife got her shots. She didn't really, 15 hours maybe is when I started to get symptoms. My wife got her shots. She didn't really get anything. She got 15 hours maybe is when I started to get symptoms. My wife got her shots. She didn't really get anything. She got a little fatigue. That's about it. But I had a little bit higher symptoms, similar to a flu shot. I had the flu shot a couple of years, but sometimes I don't get very much from the flu shot. But the second shot, I had a little bit of something. So that's probably about the time frame for most people within the 12 to 15 hour window. If you don't have anything by then, maybe you're one of the lucky ones and you're not going to get any reaction to it. I'm going to try my best to keep educating people, and I'm going to be on here, hopefully once COVID's wrapped up, I'll still be on here talking about just medicine in general or other things if people want to. I would be happy to answer just medical questions in general. I would love for you to do this on Facebook to share. I'll have to look into that. I'm newer to doing lives on TikTok. If there's a way for me to share it, I think there is a way for the lives to be, they're stored. I do know that. I can download it, I think, and then maybe upload it. I do have a Facebook page. I don't really use my Facebook page that much anymore, but I do have a Facebook page that I could upload it to there, and maybe try and share it that way. Let's see, okay. But I do have a Facebook page that I could upload it to there, and maybe try and share it that way. Let's see, okay, got it. I thought it would be 12 hours. Yeah, it's about right. Hopefully you don't have anything, though. I have a planned surgery within the next month. Should I wait to be vaccinated? It's a personal decision, and also maybe check it over with your hospital or surgery center, I don't know where you're having your surgery at, and see what their recommendations are. So our current guidelines are if you're more than 14 days out from, now it's 10 days. If you're more than 10 days out from your second dose, you're considered to be vaccinated status. Although we recently just changed our guidelines for preoperative testing, that everybody is getting getting tested 72 hours, within 72 hours of surgery, whether they're vaccinated or not, because of the unknown of the Delta variant in terms of its transmissibility. We hopefully aren't going to be transmitting it to anybody through our circuits on our anesthesia machines because they have very good viral filters on them anyways. We do have special COVID filters that we've been adding during the pandemic, but most of our machines are pretty protective. But I would ask the surgery center or the hospital that you're going to what they recommend. Most likely they'll recommend you probably get it if you're a month out. You said second shot, so you probably already had the first one, I'm assuming. So if you have your second one soon and you're just not going to run you up to the day of surgery, you can still have it done. And if you're at a hospital that, if you're considered fully vaccinated, you might not need a COVID test. So it might save you the trip to having to get one done. But you just got to might want to ask them, because there are a couple of hospitals now that are changing their preoperative testing to require a COVID test despite vaccination status. But if you have the added benefit of having been vaccinated and not having to do a COVID test, then that's another reason for you to go ahead and knock your second dose out before surgery. Does it have to be 2 weeks between both doses? No, so I meant 2 weeks after your second shot, you're considered to be fully immunized, 10 to 14 days. But your Pfizer, if I remember correctly, is 19 to 23 days after your first dose to get your second dose for Pfizer. And I think Moderna is 1 month. Maybe 28 days. I don't know if it's 28 days or considered 1 month, whatever it was. But those were the two I remember off the top of my head. All right, well, I'm going to go and try to enjoy my weekend now. Maybe I'll be on tomorrow. I'll come on here live. Feel free to ask questions. I do have a Q&A section on my TikTok page, so if you want to drop questions there, it'll also give me ideas for things to talk about with you guys the next time I go live, and that's when I try and do the question-answer sessions, questions that I get asked. So feel free to drop a question there. How long should someone... All right, last question. How long should someone who has recovered from COVID wait to get vaccinated? I actually don't know the answer to that one. Most likely, they're probably going to tell you a couple of weeks, and it also depends on what happened while you were infected. If you are still really short of breath and having difficulties,